helping you find your happiness. Do you have a vitamin D deficiency? And here's how to tell. Today we're examining a topic that affects millions of people worldwide, vitamin D deficiency. You might be wondering, how can I tell if I'm deficient? Well, stick around because we're going to explore this question and give you some practical tips to help ensure you're getting enough of this essential nutrient. So let's start with the basics and a definition. Vitamin D is often called the sunshine vitamin. This is because our bodies can produce it when our skin is exposed to sunlight. It plays a vital role in various bodily functions, including bone health, immune system support, and mood regulation. Now, you might be thinking, if it's so easy to get from sunlight, how could anyone be deficient? Well, that's where things get interesting. Despite its availability, vitamin D deficiency is surprisingly common. In fact, studies suggest that up to 40% of adults in the United States may be deficient in this crucial vitamin. But here's the kicker: many people don't even know they have it. The symptoms of this deficiency can be subtle and can easily be mistaken and attributed to other causes. That's why it's so important to be aware of the signs and risk factors. So, what are some common symptoms of vitamin D deficiency? Well, that's up next. We'll also tell you about a surprising connection between vitamin D and a common health issue that affects millions of people. Make sure you stick around for that. You might find it interesting. Now let's talk about those symptoms. Fatigue is a big one. If you're feeling constantly tired, even after a good night's sleep, low vitamin D levels could be to blame. Muscle weakness and pain, especially in your back and legs, can also be indicators. Some people experience mood changes like feeling down or irritable. And if you find yourself getting sick often, your immune system might be struggling due to insufficient vitamin D. But symptoms alone aren't enough to diagnose a deficiency. That's where blood tests come in. Your doctor can order a simple blood test to check your vitamin D levels. Your healthcare provider can share with you the optimal levels for vitamin D and give you recommendations for treatment. Here's an interesting fact. Vitamin D isn't actually a vitamin in the traditional sense. It's a prohormone, which means it's a substance that the body converts to a hormone. This is why vitamin D can have such wide-ranging effects on various bodily systems. Another interesting aspect of vitamin D is its role in athletic performance. Some studies have shown that athletes with higher vitamin D levels tend to have better muscle strength, faster reaction times, and improved overall performance. If you're an athlete or fitness enthusiast, maintaining adequate vitamin D levels could potentially give you an edge in your training and competition. Now, who's at risk for vitamin D deficiency? Pretty much anyone can develop it, but certain factors increase your chances. People with darker skin tones have more melanin, which reduces the skin's ability to produce vitamin D from sunlight. Older adults are also at higher risk because the skin becomes less efficient at producing vitamin D as we age. If you live in a northern latitude or an area with fewer sunny days, you might not get enough sun exposure to meet your vitamin D needs. Spending most of your time indoors or always wearing sunscreen when outside, which is great for preventing skin cancer by the way, can also limit your vitamin D production. Certain medical conditions can affect vitamin D absorption or metabolism. These include Crohn's disease, celiac disease, and cystic fibrosis. Obesity is another risk factor, as excess body fat can bind to vitamin D, making it less available for use in the body. Now let's talk about how to ensure you're getting enough vitamin D. The most natural way is through sun exposure. But before you run outside to soak up those rays, remember that too much sun exposure can increase your risk of skin cancer. A general guideline is to aim for about 10 to 30 minutes of midday sun exposure, several times a week. The exact amount needed can vary based on your skin tone, location, and the time of year. Diet is another important source of vitamin D. Fatty fish like salmon, mackerel, and tuna are excellent sources. Egg yolks, cheese, and beef liver also contain vitamin D. For vegetarians and vegans, mushrooms exposed to UV light can be a good option. Many foods are also fortified with vitamin D, including milk, orange juice, and some cereals. If you're concerned about your vitamin D levels, supplements can be an option. However, it's crucial to consult with your healthcare provider before starting any supplement regimen. They can help determine the right dosage for you based on your individual needs and risk factors. It's worth noting that vitamin D supplementation has been the subject of numerous scientific studies. While the results have been mixed, some research suggests that maintaining adequate vitamin D levels may help reduce the risk of certain cancers, heart disease, and autoimmune disorders. However, more research is needed to fully understand these potential benefits. In conclusion, vitamin D deficiency is a common but often overlooked health issue. By being aware of the symptoms and risk factors and taking steps to ensure adequate intake through sunlight, diet, and possibly supplements, you can help maintain optimal vitamin D levels. Remember, your health is in your hands. Take charge, stay informed, and always discuss any concerns with your healthcare provider. If you found this information helpful, please like and subscribe to our channel for more health and wellness content. And don't forget to share this video with friends and family who might benefit from learning about vitamin D deficiency. Thanks for watching.